both of you, and someone said, like 30 years ago, I hate to bring up these stories, but some things have an impact on you, your heart doctor. He said that 50% of people that have their first heart attack don't see the next day.
That's right.
I don't know if that's true or not, but that's what I was told.
That's right.
I thought to myself, how do you not have the first heart attack to begin with?
That's right.
What can we do about that? So I want to, in terms of prevention, I'm just looking at how much we're spending, and only 3% of dollars are allocated for federal dollars for prevention. That makes no sense. It's kind of like lung cancer and these other things. If you don't do the test, you get into a lot more expense. Someone says, well, I can't afford to eat that way. So in some ways you can't afford not to.
Yeah.
But you're the heart doctor. What's your thought about this whole idea of prevention and 3%?
You know, I think from the policy-making standpoint, now, first of all, it's not just government. I mean, this is to empower individuals to make the healthy choice the easy choice is what I think policy needs to actually do. So we need to, A, support the science, get as much evidence as we possibly can. The 3% figure is exactly right. The 5% figure I gave for funding about nutrition research, so we really know what works short-term, mid-term, and long-term. We're going to actually have to increase that body of knowledge. The testing, and this committee has done superb work in passing legislation to increase the testing early on, the diagnostic testing, which is unbelievable. I think, which is fantastic, because if you're not testing early, you're not going to pick you up early. And then from the old days, or my days, and where we are really with Medicare today, we do well in terms of treating the heart attacks and the diabetes. It's really expensive. And to lower that expense, we're going to have to get from the testing, make sure that people who have a positive test actually get the treatment themselves. And that means that there are real opportunities for you in this committee to make sure that, yes, A, you get the test and you've moved in that direction. The acute care system today and chronic disease system needs to be improved systematically, but there is a gap in between the two to make sure if you get that particular test, you actually get the ultimate treatment that you need at a point in time. And that gives opportunities for these newer technologies like telemedicine that after COVID we realized are so important to bring people into the system. And that's where I think a lot of the policy opportunity is today. Yeah. So first, the evidence is, the food as medicine is crystal clear today. What we need to do is to be able to build that body of knowledge over time, have policy actually set the guide rails, and then recognize that the private sector, the nonprofit, which SCAN is a beautiful model of, and the for-profit sector to be able to accomplish the reality of what the policymakers intend, all working in hand in hand.